Welcome to the Unconventional Dyad podcast, where you'll find broad topics, an unconventional dyad, and one shared goal, educating ourselves through challenging and engaging conversations. Your hosts are Carli and Laura, two graduate students and friends committed to having discussions that are real, raw, and unpolished. Thank you for joining us. This episode of the Unconventional Dyad podcast is sponsored by Anchor. Anchor is the easiest way to make a podcast. The most important thing about Anchor is that it's free. They also have creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you, so it can be heard on Spotify, Apple Podcasts, and many more. It's everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started.
Hey everyone, thanks for tuning in to episode 4 of the Unconventional Dyad podcast, where Laura and Carli discuss the fear of doing nothing. Before we get started, we have a few exciting announcements to make. Next week, we will have 2 different guests on our podcast, and we'll also have 2 different episodes, Carlos Padron and Dr. Claudia Luis. We hope you can tune in to those episodes. We are so excited to have a conversation with both of them. We're going to be talking about working with minority and underrepresented populations, as well as talking about feminism, what it's like being a woman in this field, as well as just clinical education in general. Our website has a new feature now. In addition to our regular blog, we have added a creative writing blog to our website featuring fiction, nonfiction, and poetry written by your favorite dyad. Check out our first creative post, a short story called The Fence by Laura. Stay tuned for more creative writing posts coming very soon. You can also tune into our weekly blog posts where we discuss a variety of topics, including therapeutic technique, self-care, supervision, as well as just what it's like being a graduate student in an academic career. We hope you liked the episode. I know Laura and I had a really fun time talking about this book, and we hope you enjoy it too.
So today we are talking about The Fear of Doing Nothing by Valery Hazanov. And I just want to start off by asking you, Carli, what this book means to you.
I was introduced to this book right at the beginning of my training. I actually heard him talking about this book on a different podcast a few years ago, and I was really inspired by what he was saying, and I decided to read the book. And again, it was right at the beginning of my training, so I think that it really shaped how I look at therapy, how I view therapy, how I approach therapy, and I don't think it could have come at a better time. I think reading the book right at the beginning of my training was just really great.
Absolutely. Yeah, I definitely agree. I mean, I just recently finished the book, so I was a little bit behind you in that sense. But I heard you talking about it and kind of telling me how much you enjoyed it, and I picked it up and recently finished it. And I think to me, the thing that stands out most is just how comforting this book was to me reading it. So obviously the book is about the fear of doing nothing, this fear that a lot of therapists and mental health clinicians and psychologists have, that they're really not doing very much in psychotherapy when they're providing services to clients. And I feel that a lot. I feel like I'm doing almost nothing every session, and I think it was just really comforting to read somebody else's account of that and to know that someone else also feels the same way, especially somebody who I kind of view Valery as a very successful psychologist. I've looked into some of his other work, some of the things that he does clinically, and it's comforting to know that someone as successful as him also feels very unsure from time to time.
Going off of that, I'm always really comforted by professors or other professionals saying similar things, saying, when they were in training, they were having difficulty
figuring out exactly how therapy works, figuring out what to do. It is really comforting knowing that everyone kind of feels that way at some point or another, and just knowing and having faith that eventually that feeling will go away to some extent. I think we'll always experience that, but knowing that we will get more comfortable with doing nothing is quite comforting.
Yes, absolutely. Yeah, one of the questions that this book posed right at the beginning really is the question of how does psychotherapy help people? How does it actually create change? How does it help people change? What do you think about that question, Carli?
I think that is a very big question. And it's something, I mean, there are people doing tons of research on exactly what creates change in therapy, how therapy works. And honestly, I really don't know. Sometimes I feel like I have a pretty good understanding of how therapy is helping them. Mm-hmm. Others, I have not the slightest idea how therapy is helping. You see them getting better, but you don't know exactly what it is that's actually helping that person.
Yeah, and that's a scary thing to have to contend with and to accept as therapists. I mean, we go into this field because we believe that therapy can change people, right? And to basically come to terms with the fact that a lot of times we don't know how it works, that's really scary. To me, at least, that's really terrifying that I don't exactly know how this is all working.
I also think a lot about individuals' certainty about therapy, the confidence that they have that what they are doing is actually creating change. And I'm always a little bit hesitant to really fully go on board with that. I'm always a little bit like, I question individuals who really think they have a pretty good understanding of how they're creating change, whether it's regardless of the model that they're using, whether it's CBT, third wave, psychodynamic psychotherapy, humanistic, whatever it is. I always am kind of questioning the people who are very certain about their kind of influence on another individual in therapy.
I think when I first started graduate school, I was really eager to believe that people have the answers. Other therapists, other psychologists, other supervisors have the answer, and if I can just talk to them, they'll let me know what has worked for them and what I can implement myself. But I think I agree with you now. I'm much more suspicious of those individuals because I don't think there's a whole lot of certainty in this field. And unfortunately, a lot of research tries to prove otherwise, sometimes to a detrimental level. But yeah, I agree with you. I think I'm a little skeptical when I hear somebody being really sure of their approach.
Mm-hmm. Something else that I was thinking about with this question, Laura, is you work with a lot of older adults, and I'm curious about how you view change in therapy with older adults, especially individuals who are close to dying, how you approach therapy, what you think needs to be done in therapy, how people change kind of at the later stages of their life?
That is such an interesting question. I think in my work with older adults, what I've really tried to do is to be more human with them than anything else. And Valery Hazanov talks about this in his book. He kind of talks about, what happens when clients just need us to be a human being. And we're so tied up in all of our professional, requirements and professional code of ethics and all that. And we can't bring ourselves to be human with some of these clients. But I think with older adults especially, I just try to present myself as a human being in the room with them, and I try to see them and make them feel like a human being in the room with me. I think a lot of times with older adults, they're not really seen as human beings in the same way that maybe younger people are. And so for me, my goal and my aim is really to validate their experience, to make them feel like they're like everyone else. We might not have great plans for crazy amounts of change. I don't think that's always possible, especially when somebody's at the end of life. But if I can just give them some sort of comfort or some sort of validation, I think that's really what I'm aiming for. And it doesn't sound like a lot. It really doesn't sound like I'm doing much. And I'm really not. I think I'm just trying to connect with them on a human level.
I would imagine that your work with older adults initially, as a kind of someone in training, that was really difficult to recognize that ultimately the work that you're doing, maybe you aren't doing a whole lot, and being able to tolerate and kind of sit with someone without doing a whole lot. I imagine that was really hard.
Yes, it was really hard. And a lot of my older adult clients actually brought that up to me. And they would call me out on it. And they would say, how are you supposed to be helping me? How are you helping me right now? What can you teach me or tell me that I don't know? And I don't think they necessarily meant it in an offensive way, but those are very valid questions. I mean, a lot of these clients all of these clients have lived longer lives than me, have more experience, probably have been through things that I would never, go through in my life. And so, to have to accept that I'm not going to be doing very much, that was really difficult when I first started out. I think I'm much more comfortable with that now, but it's still difficult. Absolutely.
I noticed myself feeling very insecure about not doing anything in therapy when working with people with more severe and persistent mental illness, individuals who are, dealing with a lot more chronic issues.
Yes.
And it really got me thinking about what doing nothing actually is. I think we have to be careful with those words, because ultimately I think we really are doing something, right? We're forming a relationship with someone. Despite maybe not intervening right away, we are still doing something. We're still forming a relationship. We're kind of creating space where someone can feel safe enough to talk about what needs to be talked about, or what they might not be aware of what they need to talk about yet.
Yeah.
So though we experience doing nothing as very uncomfortable, we actually are doing something. And I think this is what this book really suggested, is doing nothing is it is really scary, but we have to recognize that we actually are doing something, even at the beginning stages of therapy, when it's really pretty slow maybe, and you're just kind of forming a relationship with someone.
Yes, absolutely. I think, I agree with everything you just said. Doing nothing is ultimately doing something, and there is value in doing nothing sometimes. There's a quote in the book that ties into what you were mentioning, Carli, about working with patients who maybe struggle with psychosis. I'm just going to read that really quick. So this is on page 23 of the book. It says, "What is healing in psychotherapy with psychotic patients is seeing more in a person than she can see herself." And I wonder if you've had that kind of experience with any of your patients or clients.
We oftentimes aren't the best judges of what we have to offer, who we are. I really truly believe that oftentimes we have to reflect back to the patient who she or he or they are. Mm-hmm. It is really hard to know who we are sometimes, and really what our strengths are. And sometimes we just really have to mirror that back to the patients, because sometimes it's really hard for them to recognize who they are and what their strengths are and who they are as a person.
Yes, definitely. And I think a lot of patients have been told who they are, and they've been labeled their whole lives. And so I think part of our job is to give them a different understanding of who they are, maybe uncover a different aspect of their identity.
Laura, you've had some experience working with the LGBTQ plus population. I'm wondering if you've experienced anything similar with that population. I haven't had as much experience with those individuals. Can you share a little bit more about how you approach therapy with them with regard to kind of identity and reflecting back who they might be?
Yeah, I've been really blessed to get experiences working particularly with trans individuals, which is something that I hadn't really done prior to this year. And those experiences were very formative for me, and very important experiences in my training. And I think with a lot of the people that I worked with, I really tried to basically show them who they are, or to accept who they are in ways that maybe their family members didn't accept, or I'm not explaining this very well, but I mean, when somebody is trans, right, their identity is perhaps very often different than how they present themselves, at least initially. And so a lot of my patients had family members who were very unaffirming. They did not accept who that person was at their core. And so I thought my job in that moment was to really see that person for who they wanted to be seen as, and to accept that part of them, if that makes sense.
It gets me thinking back to this idea of doing nothing. I would imagine in that situation, the more you talk, really, the more harmful you are to that relationship. So being able to really just be receptive to what that person is saying, really being able to kind of hold what that person is bringing to the therapy, and being able to consolidate it, make sense of it, and reflect it back to that person.
Yes, and really to be able to not only hold back and sit back and listen, but to be able to invite that person to speak more than the therapist is speaking. Like, I want to know what your experience is. I want to know how you identify, how you see yourself, how you conceptualize yourself. And so, yeah, there's this balance between listening and also inviting that person to express themselves more, because a lot of times they haven't had the chance to express their true identities.
I'm thinking about a patient of mine, and I've seen him about 60 or 65 sessions now, and I would say over the past few months was really the first time that he started talking in the sessions. And this book was really influential with this case in particular. There was so much silence in the session, and I was really guided by my supervisor to just allow for a lot of silence. And I got really uncomfortable sometimes. I really don't mind a whole lot of silence, but when it gets to the point where there's just a lot of it and nothing seems to be happening, I got really uncomfortable. And it was really only after I truly sat with him in silence he was starting to talk. And it was only after me getting out of his way that he actually started verbalizing what his experience was. And it took a long time. It took 40 plus sessions for that to happen.
Wow. Say a little more about getting out of his way. I'm really interested in that.
I tend to be a bit curious, and I think that's a good thing, though I would ask open-ended questions mostly, more for my own curiosity. And I think that I was really being more of an authoritarian mother. And he did have a lot of conflicts around dependency, around, being able to choose his own way. And only after I really stopped doing that, and though I was still able to be curious, I was more, thinking silently in my mind a lot. I was thinking a whole lot during the sessions, so I was definitely doing something. But only after I truly got out of his way, stopped talking, allowed him to step into the session, did he actually start to talk.
Yeah.
And things started to happen much more rapidly. Once that process happened, he was able to talk more, emote more, really share more of his experience.
That is really interesting. So you really basically had to force yourself to quote unquote do nothing. And it was only in that silence and in that nothingness that he was able to open up more.
Not only open up, but I kind of knew that he had a lot of aggression towards me and ultimately towards his father. And he was able to verbalize for one of the first times that he was ultimately kind of angry at me. And after he was able to verbalize that, after that was allowed to be said in the session, I just feel like our work together just is moving much more quickly. I feel like he's much more comfortable talking about things that I never thought he would ever talk about.
Wow. So, yeah, that's really incredible. So you were really able to accept some of his maybe undesirable emotions, undesirable feelings. That reminds me of one of the chapters in the book, actually. I believe, I can't remember what the client's name was, but I think it might have been Sam. But there was this whole scene where Valery Hazanov, the psychologist, talks about how disgusting this patient was to him. And there was a scene where the patient brings in McDonald's and eats food in front of him, and how disgusted Valery was by that. And that just really reminds me of what you just shared. What happened with Valery and Sam is that Valery basically had to accept Sam's disgustingness. He had to make space for it, and he had to learn how to not be put off by Sam. And that was the only time that Sam was really able to find any sort of healing in that therapeutic relationship. Do you see any parallels between Sam and maybe your client?
I do. I think with me, though, I wanted him to talk about his aggression. I think clinically I have an interest in aggression, and I knew that he had a lot of it. And so I think I was pushing him too hard to talk about it. And ultimately it wasn't, I was taking away his agency. And only when he was able to feel like he had his own sense of agency was he actually able to talk about it. But I definitely have other clients where this part with Sam in the book, I definitely have felt that. Clients who have a very specific odor, clients who will lay down on the couch without me actually wanting them to lay down on the couch, kind of doing these behaviors that are a little bit odd. And it really got me thinking about what it is that person is trying to share with me unconsciously, especially around like odors and stuff. So I think there's just a whole process that goes on in our mind silently. We're kind of thinking about what is this person trying to portray? What it is that they're doing, and that's all silent. It all makes us think that we're doing nothing, but ultimately we're doing a whole lot. We're doing a whole lot of thinking and processing.
Yeah, processing, thinking, conceptualizing. I think we understand our clients so much better in the silences sometimes. More so than if we're trying to fill the silence. Because I do the same, I've done the same thing where I have talked more than I really needed to. And that was because of my own discomfort with silence and with just sitting in session with a client. I felt very compelled to do something, right? Which I think is the reason why so often I just talk kind of mindlessly in session to fill that silence and to feel like I'm doing something. But yeah, I definitely agree with you. I think I'm going to go back to something you said earlier is, we're taking the client's agency away very often when we do that. Yeah.
I think too, individuals, especially, the client that I was talking about, the patient I was talking about, ultimately change happens when that person feels empowered, when they feel like they have a sense of agency. And, we can share all we want about, you're a great person, like, you're doing such a great job, kind of providing this feedback. But with him, that was a sense of kind of entrapment, or I don't know exactly what the word I'm looking for, but doing that was really the opposite of what he needed. That positive feedback was not helpful for him. And I learned that quite quickly, that he did not need that feedback. What he needed was really to step up and start talking. And I think we were just creating this environment together where that wasn't able to happen.
Yeah, and that's such a good point that you make too. This is an environment that we create together, whether or not the client knows it or realizes it or wants to engage in this teamwork, it's happening, right? And same thing for the therapist. Sometimes the therapist doesn't want to engage in that teamwork, but really it's a collaborative process. So I think that's a very good point that you make. I also want to ask you about theoretical orientations, because Valery Hazanov, the author of the book, brings this up a few times. He's very perplexed by all of these theoretical orientations and everybody putting a label on themselves as either CBT or relational or psychodynamic, and he kind of sees some of it as pretty silly. I wonder what your thoughts are on picking a theoretical orientation or prescribing to one.
I've thought a lot about this, and you and I have worked at a lot of different settings, and I'm kind of curious what you have to say about this too. But I do prescribe myself to a specific theoretical orientation internally. I don't necessarily use that all the time in practice, but I do think more psychodynamically with my patients. And some patients have one session with you, and that's all they have. So I really think about what is the best for that patient, what that patient might need. And oftentimes I don't really know, and I just kind of try it and see if it works.
Yeah.
Whether you need to do solution-focused, kind of immediate crisis work, whether this individual has some type of phobia and you need to work through that. Like, you really have to think about what is best for the patient. And honestly, I have said to patients, I go, I might not be the best clinician or the best therapist for you. I do a different type of work. I'm wondering if you would be open to maybe seeing someone else who's better able to help you.
That's quite brave, I think, to be able to admit that to yourself and to your patients.
I don't have much experience working with a lot of different phobias and just different disorders in general. And, if I was the only therapist at the time who would take on that, or who could take on that patient, I would surely learn how to best help that person. But I have a lot of learning to do and really figuring out what works with what patients. The research still doesn't really know that completely. Different theoretical orientations work with different patients, and we don't know exactly what factors kind of create that.
Yeah, absolutely. I think we're very similar, Carli, in that I also think very psychodynamically about my patients. When I do any sort of case conceptualization, that's kind of how I think through things. It makes a lot of sense to me, but I don't necessarily think that I use a whole lot of that in my sessions with clients. So I'm actually really happy that you said the same thing, because I noticed this about myself and I felt kind of weird about it. Like, is this normal to, internally process my patients in this way and to conceptualize these cases in this way, but not really use a whole lot of psychodynamic stuff in session? I mean, I do, but I think I'm very much of the same mind in that I try to look to see what the patient needs. And that might not be, a relational approach. That might not be a psychodynamic approach. I actually have a client that I started working with more recently, and while I conceptualize of some of her concerns in a very relational way, I actually pretty much just do CBT with her, which is shocking. If people know me, I am not about CBT. I'm not crazy about it. I'm not comfortable with it. It doesn't come easily to me, but I feel like that's what the client is pulling for. And that's what makes sense in our work together. And so I've really been finding myself doing a lot of cognitive behavioral stuff, working on skills and techniques and things like that. So I totally agree with you. And I think we're very similar in that way.
I will say, though, that my preference is most definitely psychodynamic psychotherapy. And even if I do more solution-focused work with that patient, I most certainly integrate relational and psychodynamic approaches and interventions. This is kind of how I think. I really enjoy psychoanalysis, reading psychoanalytic literature, and that's kind of where I feel the most comfortable. And so I most certainly use it with all my patients, but some just don't have the time to do that work, don't need that work. I mean, some people need to, find out how to apply for food stamps, or, find out, how to call a physician for a specific issue. So I think it really depends on the population that you're serving, and also what the needs are of that population and that individual.
Yes, absolutely. That reminds me of another scene in the book where Valery steps onto a bus with one of his clients who is terrified of getting on the bus. And he really does that. He does that outside a session, right? So technically, if you really want to look at it closely, it's pretty much a boundary crossing, right? Like he violated a boundary. But he does that because he sees that that's what she needs, right? No amount of them talking and trying to process through some of her trauma is really going to get them anywhere because they have a limited amount of time together. I think he was an intern at that particular site for like a year. And he knows that one of her biggest challenges is just getting on the bus so that she can get home or so that she can come to therapy appointments. So I thought that was a really beautiful moment in the book, and it kind of reminded me of what you were saying about even applying for food stamps. Sometimes that's what our work calls for. It calls for doing things that are not really in our job description. I wonder if you've had to do anything kind of like that's really not in your job description and it doesn't feel very therapeutic, but you feel like it has been really beneficial for a client.
I can't really think of anything off the top of my head. I kind of view a lot of interactions therapeutically, even if it's something very little, like walking down the hallway to the essentially where you're going to do therapy. Even that in itself is very therapeutic. I'm always thinking about, why is this patient not talking to me? Why is she talking to me? Why isn't she talking to me? Why is she walking in front of me? Why is she walking in the back of me? So I just feel like I see everything as very therapeutic, and I think it's all relevant.
Yeah.
I can't really think of anything off the top of my head that we're kind of like outside of the boundaries, kind of like what Valery was talking about in the book.
Yeah, the one thing that comes up for me is a session I had. So I've been working with OWI clients, so individuals who have gotten a DUI or some sort of drug charge, and they're required by the court to do therapy. And so I've done a few of those sessions, and this particular client that I'm thinking of, he only had 4 sessions with me. And I mean, he was only required to do 4 sessions with me, and he was absolutely not open to doing any more sessions than he needed to do. And so 4 sessions is really, it's very little time with a client. And so I just remember spending those 4 sessions literally just helping him apply for unemployment. And in the moment, I felt a little nervous about doing that because to me, it didn't seem to be within the bounds of my, work as an intern at that particular placement or my work as a therapist or a future psychologist. But when I talked to my supervisor about it and I let her know, hey, this is kind of what I'm thinking and this is what I've been doing. In the last session, I literally spent on hold trying to call the unemployment office with him. Like we had a 3-way phone call and we finally managed to, contact somebody and get him in touch with someone to help him. And my supervisor was just really encouraging. And she said, sometimes that's kind of what we need to do as therapists, and that's totally okay. And I think that helped me feel a little bit better about that. I do agree with you, though. I think even that in and of itself was therapeutic. And I do think of a lot of maybe more mundane or ordinary life events as therapeutic when it comes to interacting with a client. I think just him having somebody who will sit with him on the line and will bear through that with him. He was very frustrated with the whole system and the whole process, but having someone sit there with him, I think probably was therapeutic. At the end of our 4 sessions together, he was very thankful. I think when he first started out, he was very defensive and angry and aggressive, and he was very short with me. He couldn't remember my name for the life of him. He kept calling me different names. And I think that just spoke to how frustrated he was with the whole system. But by the end of the 4 sessions, when we had managed to get him connected with somebody, I think having me sit with him on the line and call these offices with him was really therapeutic.
Laura, do you happen to remember the last it's been a while since I've read this book. Do you remember the last chapter? I remember that being very meaningful. And I think it would be a great way to end the episode. And I just don't remember exactly what the details were.
So you're going to hate me. The last chapter is the one that I didn't get to finish because I was so concerned with getting the book back to you. So just to let our listeners know, I borrowed the book from Carli and I returned it to her yesterday. I dropped it off in her mailbox at our school. And I had started reading that chapter. I was actually trying to finish it while I was getting a haircut yesterday. And I just couldn't manage to finish the chapter for some reason. So I have to let you down and let you know that I don't really remember it because it was so rushed trying to get the book back to you.
I'm going to free associate a little bit. What's coming to mind, do you watch In Treatment?
I've seen a few episodes. Okay. I don't watch it regularly.
Well, there's a patient named Sunil.
Okay.
And for some reason, that episode was coming up. But essentially, it's this idea of just dealing with resistance and dealing with end-of-life issues. And kind of sometimes we do have to cross boundaries. Like, from what I remember, I really hope to read this again. From what I remember, Valery went to the hospital and was doing sessions in the hospital bed with the patient. And it just really got me thinking about how we view resistance. And I'm quite curious about it. I wrote a blog post, and I most certainly will write more about resistance and really how we look at resistance. I think for me, resistance is a good thing. If people are not resisting what we're doing, there's a problem.
Yeah.
And it really kind of paints a picture of the person's narrative. And if we can better understand resistance, we can better kind of help them. And I don't remember the last chapter, unfortunately, but I just remember there being some resistance and kind of the way that Valery went about kind of dealing with it and kind of intervening.
Yeah. So what I do remember about the chapter is that the patient, like you said, was an older adult, an older man from Russia. And so they had that in common because was Valery born in Moscow, I think? And then I think he was born there, and then he spent most of his life in Israel. And so I think he and the patient kind of connected a little bit in having this shared history of having been in Russia, having been born there. But yeah, I do remember Valery writing about how the patient was very hesitant to kind of talk about himself, and the patient would ask Valery a bunch of questions about himself, and so I kind of saw that resistance there as well. And I do remember Valery going to the hospital because the patient had a lot of medical issues, a lot of doctor's appointments, and Valery went to do some of those sessions in the hospital with him. Yeah, I didn't read the last few pages.
That's
so
okay.
I don't know.
The thing I remember the most, I was crying at the last page. I most definitely was crying because I think that this was such a meaningful chapter, and it kind of just goes to show our ability to hold on to an affect or hold on to experiences that are meaningful. I don't remember the details of the chapter, but I surely remember how I felt reading it.
Well, it sounds like I missed out by not finishing that chapter. I might need to borrow the book back from you again at some point. Yeah. Any other thoughts that you have on the book, Carli, or things you want to mention?
I would love to do an episode in the future about termination. My research interest is in termination. I'm really curious about what your views are, and we don't have to talk about that today, but in the future I would like to talk a little bit about termination because I know that Valery talks about it in one of his chapters.
Yes, I would absolutely love that too. I did think about termination a lot while reading this book because all of the experiences that he wrote about were really about his time as an intern, as a practicum student, as a trainee. And as people might know, as our listeners might know, when you're a practicum student and you're seeing clients, you're terminating with them whether you want to or not, because your practicum placement eventually comes to an end, right? And so I had a really interesting experience this summer terminating with a bunch of my clients because I'm gearing up to apply for internship. I'll be going on internship next year. So yeah, I think termination is a very big topic that I would love to do an episode on with you. Mm-hmm. Well, I think that's all we really have to say about the book. I just want to reiterate how meaningful this book has been to me and how comforting it has been to me. Yeah,
I hope the listeners get a chance to read the book if possible. I found it really meaningful too, especially at the beginning stages of my training, and it is really comforting knowing that someone else also had similar thoughts that I had too going into it.
Yeah, absolutely. And I hope we can, fingers crossed, get Valery on the podcast sometime. I would love to hear his thoughts on his own book. I'm going to close with a quote from the book, if that's okay. So this is on page 35 of the book, and it says, "In the messiness of psychotherapy, the achievements are fleeting, amorphous, barely felt. Without accepting this, I believe, we cannot really accept the people we work with, cannot escape the traps of fancy-sounding jargon that hides our fear of doing nothing." Okay, and that's all we have for today. Thank you, everyone, for joining us. We will be back with some more interviews with several guests, so stay tuned for those.
Hello, Unconventional Dyad podcast listeners. We are so excited that you are joining the conversation with us. If you're liking what you're hearing and you would like to support the podcast, there are a few different ways to do that. We have a Patreon page now, so if you visit patreon.com/unconventionaldyad, you can support us through 4 different support tiers. You can also support us through the Anchor app. There's a support function, and you can choose from 3 different tiers, from as little as 99 cents per month. We really hope that you are liking the content so far. You can also check out our website where we post weekly blogs that you can comment on, and we hope that you join in the conversation with us. Let us know what you think.